In the upper third of the face, we perform the procedure following the orbital area. Stretch the skin with your left hand so the needle easily goes into the derma. Here, the distance between the papules is even smaller, only 0.3 centimeters. That's because the skin here is very thin. We move from the center to the top, following the stretch vectors. We apply papules. The product concentration is 1.8%. We create the line on top of the zygomatic arch and then up. If you accidentally traumatize the dilated vessel, just press it with a tissue for 2 to 3 seconds while you're working in another area. After the lifting is done, treat the skin surface with Decocin. The formation of microhematomas and petechiae is possible, but the big bruises won't appear after such procedure. This is how the face looks after the lifting. After the procedure, we apply daily. At first, we create a top line. In the central third of the face, the difference between the papules is 0.5 centimeters. These lines are directed from the bottom to the top, from the center to the temple zone. As our face is well supplied with blood, the papules get bigger. Here we can place 4 rows. For the convenience of papule application, you must have a support. It will make the application process easier. Your little finger can be a support. And that's the last line in this part. As the skin has its resistance and density, you may feel that the needle is not sharp enough. In this case, you may replace it. After the procedure, we apply Daily Deluxe Spray, 2 to 3 sprays with a distance of 25 to 30 centimeters away. The central part of the face starts from the nose wing. The distance between the papules is 0.5 centimeters. We must follow the skin stretch vectors. Pay attention. You must always have an obvious papule. If the papule is not visible, it means that the needle is hypoderma. If there's no blood in every papule, it means that the needle is epidermis. On this side, we also create 4 rows. If the product comes through skin, it can come through in large pores. Then you can make a shot having drawn back a little. After the procedure, we apply Daily Deluxe spray. The lifting is performed with papule technique following the vectors of skin stretch. The papule is intradermal. The distance between them is 1 centimeter. All lines or skin stretch vectors are directed from the bottom to the top. The first row of papules is directed towards the anteloboium or the hairline. You are applying papules correctly if in several seconds you see the blood appearing in every shot. Create the next line. As you see, the blood appears only when you move to the next stop. If the patient's face is quite large, 2 lines can be created. The lower third is ready. The same lines and papules must be created on the opposite side. The line must be directed towards the anteloboium or hairline. The papule is intradermal. In the lower third of the face, the difference between papules is 1 centimeter. Having previously made an anesthesia application, we are performing the redermalization of the periorbital area with the hylual medicine. In this case, we have very fine skin and a muscle perfectly supplied with blood. That is why we are going to make very fine papules. simply in papule to papule manner. The first row is done under the eye. Here we can make 2, 3, maximum 4 rows. In this area point, small microhematomas can occur. More points to this area is being greatly supplied with blood. This patient has no hernias. That allows us to go up the ciliary margin. We've made 3 papule rows. Here we have several small point microhematomas. In the same manner, we are performing this procedure on the opposite side. We are moving the skin with the left hand downwards for fixing, and we are going on with papules at close distance from one another. The first row. Next row upper. If there's no hernia, we can go closer to the ciliary margin. Now we are pressing on this area. The outer corner of the eye, here the lines go by the pattern. We either go by pattern or by wrinkles. We can see here a nevus, a benign formation. Such benign formations are to be bypassed a ½ centimetre from each side. So we are going in several rows making papules. As the viscosity of the hyaluronic medicine, 1.1% is the lowest. We can see it appearing on the skin. This is because we are working rather quick. The compression in the syringe still remains so. Sometimes the medicine can appear on the skin. But the most important for us is to get the papule. It means the hyaluronic gets into derma. In this manner, we've bypassed the nevus, a benign formation, from all sides and keep on going. going from the eye corner to the hair margin. In the frontal area, we take 1 centimeter over the eyebrow area. So the periorbital area covers the area of the lower eyelid, outer eye corner zone and temporal zone. On the opposite side, we perform the same procedure. Papule to papule at a very small distance, 1 to 3 millimeters. It is not necessary to hit the mimic wrinkle with a papule, while the medicine will diffuse everywhere, including wrinkles. As far as we are working only with the dermatic skin layer, it is impossible to reach the vessels of the temporal area, providing that the medicine injection technique is performed correctly. The second step. The third step. The fourth step. Armoring is performed with 2.2% concentration of the product in linear technique. There are 3 lines, starting from the mouth angle to the anteloboium. The linear technique is performed intradermally. When the needle penetrates into the skin, we inject the product and leave it there. The technique is linear and retrograde. The next shot. The needle must be exactly in derma and must not see the needle itself. The channel is being filled with the product. This procedure can be more unpleasant for patients than the papule one, but here the result is faster and more obvious. It's because the higher concentration is used. The quantity of the product is bigger, so the lifting effect is obvious right after the procedure. After the procedure, we may see spots of microhematomas, but it's not very common. Draw back 1 centimeter from the first row and start the second one. At the beginning, the lines are parallel. But when moving to the top, all lines must converge. We see blood appearing in every shot. It means that we are in the derma. There are no big vessels in the derma. That's why hemorrhage is impossible. We see clearly where the needle is. It is in the derma. This line is also directed to the antiloboium. Now create another line, which is parallel to the previous one. We started at 1 centimeter higher than the first one. We make a shot covering the nasolabial folds. When removing the needle, inject the product. This patient has a thick skin, so there's no particular line prominence. The prominence can be seen in the thin skin, but in this case we will receive a very good result. All the rows are visible. They are directed to the top. All 3 rows will converge. This converged spot can be either at the hairline, the antilobium and parotid areas will be treated separately. All 3 lines converged. To create a link between them and more solid a frame, we change the needle direction. Turn the head towards us and create the columns between the shots, which will significantly improve the dermal frame. Make a shot with the retrograde movement, fill in the channel. In such manner, we create so-called reinforcing ribs in the derma. We clearly see how everything is being filled. We create the intradermal frame. The main rule of the procedure is to place the product into the derma. We can judge if we're in the derma by what we see on the skin and how the needle is moving. The derma has resistance, so the needle must overcome it. The lip area and the nasolabial folds are well supplied with blood. And as I said before, armoring can cause formation of the microhematomas. That's why when we're working in the derma, of course we damage some small vessels. And so it's normal if small bruises appear after such procedure. Now, all lines are connected. Treat the skin with Decacin medical product. Same lines from the mouth angle to the hairline. The first one is done. Turn the head, draw back 1 centimeter down and make the second line, a parallel one. This procedure is recommended to use with those patients who are familiar with papule technique, as the procedure itself is well tolerated by patients, but it can cause the formation of microhematomas. The next line is 1 centimeter higher. And just like on the right side of the face, we make links, the perpendicular lines. The shot is made from the bottom to the top, and when removing the needle, inject the product. So, the framing is created, and it defines our term armoring. The product must be injected from the bottom, but injection from the top is also possible. Anyway, the product will stay in the position you've injected it in. For example, now I'm injecting it from the top. The needle puncher is not important at this moment. The presence of hyaluron in the derma is important. For example, on the left side of the face, it is comfortable to create lines from the top. Now we've made the connecting strips of armoring frame. We use the linear technique to correct the nasolabial folds. We make an intradermal shot and insert the full length of the needle. By retrograde movement, when removing the needle, you must leave the product in the derma. Now the neck shot. Again intradermally. This is how Hylual is injected. Fillers cannot be injected like that, as the product must be left exactly in the derma. We see only the needle contour, not the needle itself. If you see the needle, it means you are in the epidermis. If you don't see the contour of the needle, you're too far under the skin. In this technique, we can use not only straight lines, but diagonal ones too. In this area, we have created an additional vector. The skin around the lips has a tendency to swell. You can see it does start to swell now, but it disappears as quickly as it appears. Again, you must be in the derma. The needle is contouring, but not visible. It means we are in the derma. Fill the derma with the product when removing the needle. The technique is linear and retrograde. Done. Now move down. Use your left hand too. The right hand must have a support. Move to the next shot. Inject the product when removing the needle. Marionette wrinkles. Here we do the same, just like the opposite side. Create the additional vector. Quantity of product 2 milliliters. In the parotic area, use the linear technique. And in the lobe area, you can use the papule technique. We use 2.2% concentration. Here, the skin is thin. You're able to see the needle. The filling is very visible. Nice visualization. We create the frame similar to armoring. Here the skin is thinner. That's why the columns of derma filled with the product are clearly visible. Connect these columns with strips. The injection is performed with linear and retrograde technique. The lobe. Stretch the lobe. Pay attention to the folds. Here, don't use the linear technique. Use the papule one. Inject the product right into the wrinkle. The opposite side, use the same retrograde and linear technique. The main task is to fill the porotic area wrinkles with intradermal shots. Be sure to put your arm in a comfortable position. In this case, insert the needle from the top to the bottom, following the folds. Create the armoring of this area. The derma is being filled. Make a strut. The diagonal strut is also allowed. The main thing is to inject the product to the whole area. The armoring is done. Just like on the opposite side, inject the product to the lobe fold using papule technique. Apply several papules. The porotic area is well supplied with blood. That's why you see blood, but it's normal for this area. Treat the skin with Deca using the linear technique. Hyaluronic 1.1%, 1.8%. Hyaluronic medical product of 1.1% in papule technique is used in correcting forehead skin age changes. The correction is performed following wrinkles. The distance between papules can be up to 1 centimeter. Now we follow the wrinkle. The sequence of papule application does not matter here. The forehead is nicely fixed. That's why you must pay attention to the surface area. Of the forehead, pigment spots and problem areas. If there are any pigment spots, it means that the papule will have higher density. The papules are intradermal. They're located starting with a superciliary arch to a hairline. Hyaluronic 2.2%. The technique is armoring, linear and retrograde. Quantity of product 2 milliliters. The armoring of this area is performed using hyaluronic of 2.2% concentration. We create the separation lines. The technique is linear. The derma is being filled. Move to the collarbone level. We see the needle contour, but not the needle itself. We see the contour only. Done. Now from the jugular notch on the collarbone, move to the same angle. Insert the full length of the needle. Inject the product. We see how the derma is lifted by the gel. We've bordered the triangle. Now the folds are forming in the central part. That's why, to prevent their formation, we create vertical lines. In the central part of the triangle. It helps to prevent folding. On the opposite side, create the same verticals. The folds can be asymmetrical. That's why every case is individual. Here the folds are mostly located in the upper part. Move to another side. On the opposite side, create the same line on the collarbone, inserting the full length of the needle. The injections are intradermal. The upper edge. Now connect the triangle sides. Done. Now the folding line in the central part. Inject the product to prevent formation of more folds. Move the skin aside so it's convenient for you to work. One more row. Now we connect all the lines, central ones, with strips. To create a frame. We see the needle movement in the derma. The strips can be perpendicular. They can be diagonal as well. After the procedure, we apply Daily Deluxe spray. The technique is papule. D 3 to 4 millimeters. Distance between the papules is 0.7 centimeters. Quantity of product 2 milliliters. We use hyaluron of 1.8% to correct the aging changes of the decollete area. The technique is papule. Create a central line. The central line starts from the jugular notch to the lower third of the sternum. Continue the line from the lowest point to the collarbone. In this manner we separate the working area. The distance between papules is 1 centimeter. The upper border. Moving on the collarbone, create the papule now. So, we've created the triangle on the right side. Now we fill in the triangle and create another papule row, parallel to the previous one, just like you did before. The distance can be 0.5 to 0.8 centimeters. The next row, and the next one. Gradually the triangle is being filled with papules. The number of rows depends on the working area's surface. The papule is intradermal. In every papule we see blood appearing. On the opposite side, we perform the same action. Create the triangle to the collarbone, on the collarbone, and fill it in with the papules. In this area, we can use mixed technique, both papule and linear one, if there are any folds in the area of décolleté and sternum. Fill the particular folds using linear and retrograde technique. The linear technique is used with the 1.8% and 2.2% concentration of the medical product. After the procedure, we apply Daily Deluxe spray The hands redermalization is performed by a papule technique, with distance between the papules making half a centimetre. With our left hand, we are creating a tension for the needle to easily enter the skin. And we are going up to downwards from the wrist to the fingers. Our hands are very well supplied with blood. That is why the medicine is to be administered with great care intradermally. With each prick in the papule, a blood spot occurs, indicating our correct work in the derma. The hyaluron medicine with concentration of 1.8 or 2.2% is used for hands in an amount of 1 to 2 milliliters, depending on the area to be treated. The number of rows is individual. All the microvessels are located under the skin. That's why only small microhematomas are possible. Large bruises are not expected to occur here. The hand skin of this patient is very dry. We are bypassing the joint. And are prolonging the row up to the middle flanks. We should always create a tension with our left hand. So we are prolonging all the rows. We can put additional papules. Around the joints. The area is to be constantly treated with antiseptic. In this case, we use Decacin. The surface has been treated. We are complete. Hyaluronic 2.2%. The technique is papule. D 3 to 4 millimeters. Distance between the papules is 1 centimeter. Quantity of the product 2 to 4 milliliters for one upper arm. In this area, the skin is very thin. Under the skin there is a thin muscle. With age it stretches, becomes thinner and slack. In the gym, it is almost impossible to improve it. That's why we use redermalization procedure with the product of 2.2% concentration. The technique is papule. The injections are intradermal. The distance between the papules can be up to 1 centimeter. The number of lines we apply is individual and depends on the area of the inner upper arm. Now we're reaching the area of the elbow area. The papule is intradermal. In every papule we see blood appearing. That means we're performing the procedure in the correct manner. Complete the lines by reaching the elbow area. The elbow skin is also a very important area, as the skin here is very dry and movable. That is why here the redermalization is performed using the medicine with concentration of 2.2 in an amount of 1 to 2 milliliters. The papule technique is used intradermal depending on the area under treatment. The number of rows can be from 4 to 8. Normally, the outer surface of the elbow joint matches with the shoulder inner surface. Papule. D 3 to 4 millimeters. Distance between the papules is 1 centimeter. Quantity of the product 2 to 4 milliliters for one upper thigh. Create the intradermal papules. The distance between the papules can be up to 1 centimeter. The number of lines depends on the size of the working area. If the thigh is not large, create only 3 to 4 rows. The number of rows can be from 5 to 7, depending on the working area's surface. If after the shot the blood appears, it means that you're in the right skin layer in the derma. The rows must be parallel. Complete the lines by moving towards the knee joint area. We see blood appearing in every shot in several seconds. If the papule is applied too deep into the hypoderma, the blood will appear sooner. It means that you can damage large vessels. If you see that the distance between the papules is longer, you can create an additional row. We use hyaluron of 2.2%, 1 to 2 milliliters, for the redermalization of the inner thigh. The skin surface must be constantly treated with antiseptic. Stretch the skin with your left hand to create tension. All the lines slightly contract in the bottom. Here we create the additional row. And differ. Hyaluron 2.2%. The technique is papule. Distance between the papules is 1 centimeter. Quantity of product 2 to 4 milliliters. Begin the redermalization procedure by the abdominal area using the spiral technique. We create papules in the navel area. The distance between papules can be up to 1 centimeter. The first line around the navel is ready. The skin here is very thick as the navel is a band. Move further beyond the first row. Start the second circle. Stretch the skin a little so the procedure becomes easier. It makes it easier to reach the derma. If you see the blood appearing in every shot in 2 to 3 seconds, it means that you're in the right skin layer. Widen your working area a little. Now it's the third circle. The fourth one, and depending on the working area size, you can make several of such circles. The skin is thick here, so if you feel resistance, you can replace the needle. Gradually, we are widening the borders of the working area. The skin must be stretched. The papules must be visible. The skin surface must be constantly treated with an antiseptic. Hyaluronic 2.2%. The technique is papule. D 3 to 4 millimeters. Distance between the papules is 1 centimeter. Quantity of product 2 to 4 milliliters. This redermalization technique of the abdominal area is as following. Create a central line on the abdominal area, above and under the navel. Now the lines must be directed to the outer edges of the abdominal area and go up slightly. The scar can be treated too. It's not new, but you could inject some product there too. Depending on the surface area, the number of lines can differ. The larger surface you have, the more lines can be created. Now, from every papule under the navel, create the papules following the lines from the bottom to the top. The skin here is thick. Use your left hand to create tension. It will help you reach the derma easily. Also, you can make lines from the center to the outer edge, if you wish, but all lines must go slightly up. And now we go to the rib area. move to another side. On the opposite side, start working from those papules from the center. Then move towards the outer side of the abdominal area. Stretch the skin so you see how papules are getting bigger. Here we move from bottom to the top. The number of rows can differ for each model. That's why we must check how the skin is stretching in the abdominal surface area. Continue applying the papules, but remember that the lines must go up a little. Now we reach the upper row. We can correct the epigastric region. In other words, we can move slightly up. Follow the triangle and fill the epigastric region. The necessary quantity of the product for such abdominal area is 2 milliliters. If the area is larger, use 4 milliliters. The area for the buttocks redermalization begins with the sub-buttock fold and ends by the upper third of the buttock muscle. Thus, we can make the rows of intradermal papule from the sub-buttock fold and upwards. The distance between the papules make about 1 centimeter. All the papules are intradermal. The distance between the rows makes up to 1 centimeter. The numbers of rows is very individual and depends upon the skin area being processed. In average, it can make 6 to 10 rows. A blood stain must occur in each papule. It proves that we work with the dermal skin layer. Then the processed area is to be treated with antiseptic. Here we are using a spiral technique on the buttocks area. This is another pattern papule-wise. These are the first papules. Thus, we are making a spiral motion, gradually extending it from the center, holding the skin with your left hand. To make the procedure easier, we create a tension. Thus, we are extending the borders of the pattern. We don't go to the centre anymore, but we add one more row in the sub-buttock fold area. To make a lifting effect.